thank you all for allowing me to bring you this very important issue that affects us all. Are you satisfied with your health care? Do you think it is the best you could have? According to the World Health Organization, the United States healthcare system ranks 37 in the world and is gradually slipping down. There are more than 40 million Americans without health care insurance, and the number is on the rise. Those Americans fortunate enough to have health care insurance find that their premiums have gone up considerably, while the amount of coverage has gone down. There are several areas in which we can compare the workings of a socialized healthcare system versus our current private one. However, before I start the comparison, I would like to point out that there are some advantages and disadvantages to both systems. Neither system is perfect, but the socialized system is by far superior in these key aspects: cost per capita and overall cost to the nation, access to the system, and the quality of the service. Access to basic health care is not supposed to be a privilege. It is a human right, one that ensures the ability to enjoy to the fullest all of the other rights that a free society provides us. In order to begin to understand the true cost of healthcare insurance, let me present you with some figures. The United States spend twice as much per year than any other industrialized nation on healthcare, approximately 7,200 per capita. In comparison to Canada spends around 3,700 per capita. The U.S. spends around 15.3% of its GDP in healthcare, while many other industrialized nations' healthcare costs around 10 to 13.5% of their GDP. Why is this big difference in cost? It's very simple. In a private system of healthcare, a very substantial amount of money, more than 58%, goes toward advertising in order to compete with other insurance companies, unnecessary paperwork, and the lucrative salaries of company executives. On the other hand, in a socialized system, there's no need for advertising. Only medical related paperwork is necessary. And since the system is non-profit, a considerable amount of funds are saved on salaries, therefore leaving more money for actual health care. This brings us to the next big point: accessibility. Our current private system works based on your income. The more money you make, the better care you have access to. What this does is excludes a very large part of the population, approximately 47 million people to be more exact, and the number is on the rise due to our state of the economy. Not to mention, at least 30 to 40% of the people that do have health care insurance do not have adequate coverage, in part due to very high deductibles or very high copayments. Another enormous issue presented by the private system in terms of accessibility is pre-existing conditions. In other words, if you're not a healthy individual, it is very difficult for you to purchase into a private healthcare system. If you have any form of cancer, I believe you have to wait something around the lines of 5 years to gain access to healthcare insurance, and that is if you're cancer free. In In some other cases, the insurance companies will grant you access, but will exclude treatment for pre-existing conditions. In a socialized form of healthcare, none of the previous situations are a problem. There is no membership. Every person living in the country has access to it. This is achieved in the way the funds are collected and distributed. For example, in Canada, a great part of their healthcare system comes from sales taxes, and a small part from property taxes and payroll taxes. Yes, I understand us Americans hate the word tax, but to put it in perspective, there are no people in Canada going bankrupt, losing their life savings, or losing their house to medical expenses. Here in the U.S., that happens very frequently. This brings me to the final point, the quality of the service. There's a big misconception about the quality of socialized healthcare versus private. Maybe in part due to the lack of information. Here's some simple facts about the system. Because the private system is a for-profit system, the doctors get paid in relation to the amount of patients they see and the frequency in which they see them. So from the doctor's perspective, they cannot solve all your health problems because you'll stop going to their office and their paycheck will disappear. And from the insurance perspective, in many instances, they interfere with medical decisions and even encourage doctors to use less effective methods of cure in order to save the bottom line. In the socialized system, doctors generally enjoy a very comfortable salary, and the system provides incentive to doctors to maintain their patients in a good health. Finally, after establishing that health care is not a privilege for the few that can afford it, but a right to all, I would like to conclude by saying that the main reason the private insurance industry spends so much money in propaganda is not because they care about every American, but because they want to increase their bottom line, and the idea of a socialized healthcare system puts that in jeopardy. Thanks.
Say your name.
John. Manuel.
Yusuf.
Brenda.
Eddie.
Enrique.
Mark.
Mike. ¿Tú bien?